Hi everyone, this is Dr. Stefan. In this video, I'd like to do something a little bit different. I'd like to give you 5 areas which I think if we all apply, we'll have better interactions with our doctors. So what I really want is from this video is to try to give you some understanding from a doctor's perspective of what would help us build a better rapport during our consultations to actually get the most out of your doctor. So if you're going for a consultation, I want you to get the most out of that consultation, and I want to give you some perspective from the other side as a doctor. What would help? So let's get into it. So the first one, do understand that most of the doctors you'll see, they really want to help. And I know there's a lot of bad press regarding doctors. They're fat cats. They're all after the money. There's all this stuff that's being peddled online. And, you know, there's this sort of mystical thing sometimes that, oh, the doctors are not human. They're like in their own little bubble. But no, it's just imagine that your doctor, you know, it takes a long time to become a doctor. It takes a lot of commitment, a lot of personal sacrifice. And once you gain the skills that you have to help people, you really want to use those skills. So most doctors will really want to help you. But it's just, this brings me to number 2. Try to understand that your doctor works in a system. Most doctors don't operate as individuals. So even if they're in their own private consultation room, they may still have to work in a system. And that means that you will always have, as a doctor, limited time, limited resources. There will always be other patients waiting. So this is one of the biggest issues that I face personally, because I don't have time sometimes to actually express what I need to express in certain cases. I don't have time sometimes to provide all the explanations. And I know this may sound like an excuse, but how much can you do in 20 minutes? I mean, think about your own profession. If you had to explain your own field of work to someone in 20 minutes, would you be able to do it? Would you be able to provide a solution sometimes in 20 minutes? It's really hard sometimes because it's not mathematical, and I'll touch upon that a little bit later. The other thing is to try to remember that your doctor, especially if they work in a hospital environment, there will be a lot of pressure from management to deliver certain targets. It's like any other job. So you will need to see a certain number of patients. You will need to see a certain number, do a certain number of procedures. You are expected to provide these things, even though sometimes you may have easy cases and complex cases, and they all mix together. So the other thing would be there's pressure from regulators. So medicine is a very regulated profession. So this means that sometimes you need to follow rules that sometimes don't make sense. And this limits you because you need to sometimes hold back your emotion. You need to hold back on human connection and things like that because you need to provide this service. Otherwise, you lose your job, basically. You lose your license. So sometimes you may want to, make some jokes with your patients for 5 minutes and actually get them to relax, but you can't do that. You can't show your true emotions sometimes, and it's really, really difficult. And if you understand that your doctor sometimes may feel like a cog in the system, just like many other employees feel somewhere else, you'll probably have a better chance of building rapport. The third thing, so do understand that doctors don't know everything, and that's okay. Okay, this is a bit of a tricky one, because if you think about it, you do go to your doctor, you expect that you'll be provided with solution A, B, C for all your problems. But doctors are specialists. Most doctors, they don't have broad knowledge of the entire field of medicine. It takes many years to develop that. So most doctors you'll see will have very specialist skills. And actually, even doctors who are younger or older, the age doesn't really play much of a role here, although experience does play a role. But also, imagine that if you are being treated for a very specific type of cancer, let's say, you may want to see a doctor who has the specific skills in that area. And that means that they will be able to provide you good advice regarding that specific problem. But if you're talking about other problems that don't fall under the expertise of this particular doctor, they may not be able to help you. And that's okay. So try not to push to get solutions for all your problems in one consultation, because that may not be the right way. So most doctors actually recognize their own limitations in terms of knowledge and skills with regards to certain conditions that they're not treating on a regular basis. So they may refer you to a colleague. They may refer you to another specialist who knows how to help you in that situation. The other thing a doctor will sometimes do, because of the limited time, resources, etc., that I was talking about at the previous point, they may actually tell you, look, I don't know what's the best approach in your case. So please, can you come back and see me in a few weeks, in a month. And then in the meantime, maybe they'll request some tests, maybe they'll consult with some colleagues, maybe they'll have a discussion between the rest of the medical team to try to determine what's the best solution in your case. The other thing that your doctor may sometimes do, if they tell you that they don't know something, but you provide them with a lot of information and what you would want to do, they may filter out the information that's not relevant in your case. Because if you go online and you try to see solutions for or diagnoses for different medical problems, you'll see so much information. It's a bit of an overwhelm. But the medical knowledge that you gain through medical school, through your own experience, actually gives you the possibility to triage what information is relevant for each patient. And I think that's really important. And try to understand that your doctor is actually trying to do that most of the time, even they tell you that they don't know something about your particular case. Number 4, understand that medicine is also an art. It's not only science. And this can be really tricky. I've struggled with this sometimes with patients. I must be honest. Sometimes people see medicine as a black and white thing. You have this guideline, you apply it to the letter, you have this clinical trial, you want to receive the treatment that has been shown to work in this particular clinical trial. But remember, science, research is done on groups of people which may be representative to a larger population. So that means that we are extrapolating from a limited body of knowledge to the whole population. And patients are different. People are different. They're variable, genetically variable. They have different social conditions in which they live. You can't really apply everything to everyone. Conditions, diseases, they have different presentations. Sometimes a certain thing that you read in a textbook does not apply for your patient, but they still have the disease. So these are things that are there. And we always, as doctors, operate with incomplete information. We will never have all the tests that we want. We will not have clear black and white answers. There will always be something that can surprise us. So this is really, really hard because your doctor needs to judge what's relevant in your case, what may work in your case. So this is where the art comes. Guidelines that are in force, for example, in certain specialties, may sometimes limit what your doctor will be able to do. But that means that some patients will fall outside the guideline. So, for example, if for a specific type of cancer, the guideline says that you should treat with this chemotherapy regimen, it may be that applies for 80% of the patients, but for some, it does not apply. And what do you do then? Then you need to count on your doctor to try to provide that art that's beyond the science. It's gut feeling sometimes. It's sometimes feeling that in this particular case, we may need to try something that's not in the guideline, but that's really hard if you work as a cog in the system, if you are regulated by all these policies. So try to remember that your doctor is trying to do the best, but sometimes you need to work with them to try to see what might be beneficial in your case, because we may also need to deal with social problems. We may need to deal with financial and economic burdens. We may also need to deal with psychological issues that our patients may have. So sometimes we see patients, I personally see patients sometimes who I know they don't make the right decisions from a health perspective for themselves, but you can't really push because it's their decision at the end. It's their body, it's their choice. So that's one of those things. The fifth thing, and I will conclude with this one, and it's a bit strange, this one, I think, but try to be thankful. So going into a consultation, try to be thankful. Even if the consultation will go badly, fine, okay, just don't go back to that doctor. But do remember that gratitude is the highest form of currency. And if you are grateful for what you do receive from the consultation, a thank you from your heart will be more valuable than any amount of money. Or maybe just write a little note on a card and give it to your doctor if they've helped you in some way. That's personally, I will tell you, I have some of these cards. I still have them after many years. I sometimes look at them, and I remember that person who gave me that card. They wrote something, oh, you've helped my mother in a difficult time. And it's something that really, money can't buy that. Money can't buy that memory, that feeling that you get that you've actually done a good job and helped someone. So try to be thankful in that regard. And also the other thing is try to acknowledge if your doctor's having a bad day. So if you see that the hospital is collapsing under the pressure and everyone's just running around, putting out fires left and right, try to acknowledge when you're going into your consultation slot. Just tell your doctor, are you okay? Are you managing today? look, this is what I came to see you for. This, if you start off the conversation that way, it really takes a real pain of a doctor to tell you off or to not have a good rapport with you. If you acknowledge that they're a human being and they're also trying to do their job. The other thing is, have some patience when you're waiting for your consultation slots. I know this can be difficult if you've booked your time to the letter on the day, but sometimes consultations get delayed. You may be booked in for 1:30 and the doctor may only be able to see you 2 hours later. That can be beyond their control. Imagine there's one person doing consultations. If you have 20 patients in a day, for example, and you need to see 20 different problems, different psychologies, different personalities. For some people, for some consultations, it can go really quick. You can get it done in 10-15 minutes. For others, it may take an hour because a lot of explanations need to be given. There's a lot of things that need to be addressed. So it depends. So if the clinic overruns and the doctor can't see you at the allotted time, try to not be impatient and tap your leg and put pressure. The doctor isn't seeing me. Blah, blah. Don't do that. Don't do that. It really creates a lot of pressure. And when you go into the consultation, the person who's seeing you may try to help you, but it will be difficult. It will be because you start off on not on good ground, I think. Well, so just to conclude, I think I would like to say this. Try to do your own research as well. Try to know about your own condition. So if you're going to see your doctor, read about it. And ask, I love it when patients come and tell me, well, I've read about this study. I've read about this condition. Is this true? Is this true? And then I can help you actually filter out the information that's not relevant in your case. The other thing is try to take responsibility for your own health. It's really important. Like even the best doctors in the world can't fix problems that present too late. So try to go in early. If you have a medical problem, go see your doctor early. I'd like to be able to provide you with more options, but sometimes some cases present so late that the options just dwindle over time. And if you live a healthy life, if you have a good lifestyle, you'll have fewer health problems to deal with. And actually, it would be nice to actually go and talk to your doctor about how to improve your life rather than how to fix problems that are, already maybe beyond the point where they can be fixed in the right way. So anyway, this is a bit of a different perspective, just to give you some insight from the doctor's perspective, how I would improve a patient-doctor relationship. Hopefully this is helpful. If you like this type of content, if you want to criticize me, that's fine. Just leave a comment below, and hopefully we can build a better health systems, better health for everyone. All the best and good health.